bit later, we had about 26 RSVPs. So this is definitely a exciting topic that people are interested in learning about. We are recording the session, so you'll also receive a recording, and anybody that RSVP'd will receive one as well. We'll go ahead and get started, and then I might just check in with folks that arrive a little bit later than this. But I just wanted to go over a few Zoom etiquettes first. So feel free to take care of yourself as per usual. When we meet in person, we always let everybody know, if you need to get up and stretch, please feel free to do so. I know this is a learning lunch. If you're putting together your sandwich or your salad, feel free to do that as you're listening. Every B-Learning lunch is a little bit different. So those of you who have attended in the past, we like to cater them according to the folks that are presenting. So for this one, we will go through a presentation and we'll save all of our questions and comments towards the end, although we will have a little bit of participation specifically through the chat throughout the session. So that'll be fun to engage with. If you can turn on your videos, that is always welcome. It's definitely something that it makes it really fun to be able to engage with folks, but we also understand it's a little different when you're bringing a salad to an in-person learning lunch than it is to do so on video. There's just something we haven't quite got used to about that. So since this is over the lunch hour, that's understood. Please mute yourself also while the presenter is talking. And if I hear any background noise, I may just go ahead and mute people. So if you find that you are muted, please go ahead and, sorry, I can't get back to my thing, but please feel free to just unmute yourself if I've muted you and you want to ask a question or have a comment. So I've gone ahead and put the housekeeping notes into the chat for you so you can reference those at any time. And I want to introduce myself and our speaker today. So my name is Chinoa Philbaum. I am in the engagement chair for BLocal PDX, and I'm subbing for Rose today, who cannot make it and be your MC and host this learning lunch because she is getting married. So yay, Rose! If you know Rose, please drop her a line of congratulations. And then today's topic is around childcare, which has been something that we've heard about both firsthand, and then if you lead teams or work with coworkers especially since COVID, this has really changed a lot of the challenges that people already faced around childcare. So for today, we have Carola Taylor, who's going to talk with us. She is a mother, and she also heads up an action committee, the Northeast Action Committee for Family Forward. So I'll let her introduce herself after this, and she will be our presenter.
Thank you. And thank you all for joining. I'm really excited. This is a topic I'm very passionate about, and I love any excuse to talk about it. So appreciate you all joining today. And yes, my name is Carola Taylor, and I work for PixelSpoke, which is a B Corp marketing agency here in Portland. We recently also became a worker-owned cooperative. And my official title is Senior Strategist, which may or may not mean anything to you. But I also, as mentioned, do volunteer work for Family Forward. I will be talking about Family Forward a bit in the presentation, but they are an amazing local nonprofit that's really been on the forefront of advocacy work, particularly for working mothers and childcare providers. So they were largely behind the paid leave law that recently passed here in Oregon. It's the most inclusive paid leave law in the country. They'd been working on it for about 10 years, and they're now turning their attention to childcare. I really hope it doesn't take another 10 years to get something passed, but they will stick with it. They're nothing if not tenacious. So I'm gonna go ahead and share my screen. All right, can everyone see that? Great, and I would love if you could just take a few minutes. I just want to get to know you guys a little bit, and we have a good size group where I think this will work if you can just type into the chat I'd love to know where you work, and if you'd like to share, I'd love to know if you have children, just how many and what their ages are. And then I would just love to know what you hope to take away from today's webinar. Maybe what inspired you to sign up, what you might be hoping to learn. So let me see if I can actually get those questions into the chat so you can remember them. Let's see. There we go. Great. I think we've heard from most people. Just reading through some of these responses. Great. So we have a great mix of people today. It sounds like there's some folks on the call without kids, so thank you for being interested in this issue. That is not always the case. So kudos, and we definitely have some folks who have kids. I myself have well, I was going to say 4-year-old. He just turned 5 last week. 5-year-old and an 8-year-old and a 20-year-old stepson. So kind of the whole spectrum there. Oh, let's get started. So I wanted to start with this graphic. This is actually a graphic that Family Forward put together that I really like. And it just kind of talks a little bit about what care work is, which you see in the middle. Incredibly important work for which we are paid nothing or very little. And just to be clear, in this context, care work also encompasses more than childcare. It's also talking about taking care of the sick and the elderly, which is something that many employees, even if they don't have children themselves, might have to do someday. So it's really care work in general really affects most people, whether or not they have kids. And really at its core, care work is a gender, race, and economic justice issue. As of now, it affects women the most, and particularly women of color. So I know the B Corp community talks a lot about promoting an inclusive economy, and child care is very much a part of that, as is care work in general. So you see how it kind of overlaps all these different isms. There's racism. Since colonization, women of color have been separated from their own families and tracked into low-paid care work for white families. Then you get to classism, where caregiving makes it hard to keep a good job, and that leads to low wages and high rates of poverty, particularly among women. There's heterosexism, where a lot of current care policies favor heteronormative families. And often same-sex couples, extended families, and single parents are prevented from caring for their families. I mentioned the paid leave law passed in Oregon, and that one of the things that made it so inclusive was that it had a very wide definition of family and what you could get paid for if you needed to take some time off of work. And then sexism. Even in the year 2020, care work is still framed as women's work. It is often devalued and unseen. If you are getting paid for care work, it's not much, and care work in families pays nothing. So I would say that there is a greater understanding now since COVID-19 about how essential care work is. You know, in normal times, men make up the majority of the workforce, not by much, but especially at the beginning of COVID, when it was mostly essential workers still working, women made up 52% of those jobs, largely because they're in caregiving roles that are seen as essential. And I would say right now, childcare is an issue that really affects everyone, whether or not you have children, because as we're seeing, there's been a lot of challenges with reopening the economy, but it's very hard to do when working families don't have access to childcare. So this is one of many somewhat dismal stats I'll be sharing in the presentation today. But I would say, you know, going back to the idea of an inclusive economy, that childcare in particular is just one of the most formidable barriers we face when it comes to having a truly inclusive economy. And even if you don't leave the workforce altogether when you have children, just the lack of access to viable childcare options really holds women in particular back. If you do leave the workforce, the consequences can be even more dire. I'm sure that you've all heard about the gender wage gap, which we are at least talking about quite a bit now, but we don't talk as much about the wealth gap, which is even more. And employment gaps, it's not just about the lost wages, even though that's a significant part of it, but they also cost you potential wage growth. You're hurting your chances for promotion or furthering your career, and they cost you in retirement savings. So the wealth gap is even larger than the gender wage gap. And as we talked about a little bit in the previous slide, you know, childcare is still largely seen as women's work. And it's just still more common for women to take time off to care for children. The percentage of stay-at-home dads is on the rise, but still about 20% of mothers stay home at some point to care for children, and about 7% of fathers. My husband actually stayed home for about 18 months when my daughter was born, and felt very much outside of the norm for being a stay-at-home father. He would go to the playground, it would be all nannies and mothers, and no one ever wanted to talk to him, and he didn't feel like he had any kind of community. So I think stay-at-home dads definitely are seen as much more the exception than the norm. So I did a kind of fun, depressing personal exercise to prepare for this presentation, and I just calculated a few numbers just to kind of demonstrate a few of the points I have about our childcare infrastructure. So this is one number I came up with, 101,800. So just some fun little multiple choice. A, does this represent what I've paid off on my mortgage? B, does it represent what I've contributed toward my retirement? Or C, does it represent what I've paid in childcare costs since 2008? I wish the answer was A. I also wish the answer was B. Unfortunately, that's not the case. The answer is C, and that number actually increases to about 119,000 when you factor in lost wages. I took a total of 22 weeks for both my children for maternity leave, 10 for the first, 12 for the second. I did get partially compensated through short-term disability for my first child, but didn't get compensated at all for my second child. And so when you factor in those lost wages, that number increases by quite a bit, because contrary to popular belief, you know, maternity leave is not just about recovering from childbirth, which kind of getting compensated only through disability tends to imply that, but it's also about care work. It's about taking care of this new little human who's in your life and can't do anything for themselves. So here's another number, 167,970. So does this represent A, the annual salary of a childcare provider? B, the amount my children have contributed to our family income? Or C, what my childcare costs would be to date if I'd paid the average monthly rate in Portland? So you guys might have picked up by now, it's not A, unfortunately, and we'll have more on that in a minute. It is definitely not B. And it is C, the average cost of daycare in Portland right now, and it's higher in Portland than in other parts of Oregon, but it's around $1,500 per month per child. I have used the gray market. It's a term coined to describe people who find unlicensed childcare providers like family members or neighbors to take care of their children. So for 1 year, I paid a stay-at-home mother who already had 3 children of her own, and it wasn't a big deal to add another one into the mix. So I paid her $500 a month to watch my daughter. And I've also leveraged a lot of in-home daycare providers because they don't have as much overhead. The costs tend to be lower. They do, there's a lot of variation in quality, and they can be very hard to find. A lot of in-home daycare providers don't have websites. You can't Google them. I've had mixed experiences, but did manage to shave off about $67,000 from our childcare costs by leveraging those other options. So here's one more number. 14, does this represent the percentage my salary increased when I became a mother? B, the number of months I got for maternity leave? Or C, the number of times I've had to find a long-term childcare option over the last 8 years? So A is definitely not the case. And actually, there is data that shows that working fathers tend to get raises when they become fathers, and working mothers tend to get penalized when they have children, both in salary and promotion potential, which reflects my own experience and probably a few other people on this call. B, we know that's not the case. I already mentioned that I got about 22 weeks for both kids. The answer is C, and by long term, I mean, looking for care over the summer and during the school year, but it's not just a day or a week here or there. I'm looking for some kind of sustainable childcare option. And I just have to emphasize, and anyone on this call who's had to look for childcare, I'm sure has had a similar experience, just how much work it can be to find a minimally viable childcare option. It's not just about, finding the awesome childcare provider with a community garden and goats roaming around the property, but you have to take into account cost. You have to take into account convenience and also quality. So for most of these 14 childcare searches, I've put together complicated spreadsheets. The search has involved unreturned voicemails, multiple tours, multiple meetings. It's a huge project no matter which way you cut it. And then I also put together this slide. So that number I quoted for how much I've personally spent on childcare, about $101,800. That increases by another $10,000 when you just factor in all the days during the school year when you still have to find childcare. I'm not talking about the summer here, and I'm not talking about sick days or snow days. So what I did was just looked at 2019 and all the days that my children were off from school or preschool, but I was not off from work. And those are the red X's you see. So it's really not just a cost issue. I'm sure some of you are familiar with the terms mental load or emotional labor or invisible labor, but finding childcare is just a task that never goes away. I am always thinking about it. If I don't have to find it the next week, I have to find it the following week, or I'm thinking about what the heck I'm going to do in the fall if the schools don't reopen fully. It's always on my mind. And the calendar brings up another pertinent point, is that yes, we do have a government-funded school system, and I'm talking about normal times, not what school might look like in the fall during COVID. But even when your kids make it to kindergarten, there's the equivalent of about 15 weeks of childcare you still have to piece together, taking into account vacations and summer, and then just all the random days they decide to have off. And school also ends at 2:15 in the afternoon. And I don't know about you all, but my workday does not end at 2:15. So when my daughter reached kindergarten, I thought I was out of the woods. And then I realized I was still going to have to fork over about $400 per month for aftercare. And I'm actually lucky. Our school, their doors open at 7:45 in the morning. I have a coworker whose school opens at 8:40. So think about trying to get your kid to school by 8:40 and then still having to try to get to work by 9. It's very difficult. So back in 2012, Anne-Marie Slaughter wrote a controversial, but in my opinion, completely on point article for The Atlantic. It was called Why Women Can't Have It All. Some of you may have read it. And I did reread it recently, and unfortunately, I feel like everything she said 8 years ago still holds true today. And she asked this question, what would help women with work-family balance, to many women? And her assistant emailed her this response, which was in all caps, and made the point that the present system is based on a society that basically no longer exists. It's one in which farming was a major occupation and stay-at-home moms were the norm. So again, even when your child reaches kindergarten, my youngest is supposed to go into kindergarten this year. It's going to be a very atypical school year, but even under normal circumstances, there would still be so much childcare to piece together if you work full time. And for those of you on the call of kids, I'm sure you're worrying like I am about what school is going to look like in the fall and how you might be able to continue working if your children are only going to school 2 days a week or every other week. There just seems to be very little acknowledgement that many families have two working parents who need childcare at least 40 hours a week. As an example, I was filling out the survey for PPS when they were trying to just gather opinions from parents on what school should look like this fall. And there was a question about, why do you want your child to return to school? And there was, academic development, socio-emotional development, a bunch of different options. All that's important to me, of course, but not a single option was, I need to work. It's a huge reality for most working parents. Even all that said, I would say it's the 5-year gap between birth and kindergarten that's undoubtedly the most challenging just to piece together childcare, and definitely the most expensive. And there are times when I really feel like I'm the only one facing childcare challenges. At some of my jobs I have been, but I always have to remember I'm not alone. There are 5.1 million families in the United States in which both parents work and who have children who aren't yet in the public school system. And again, so many more families with children in the public school system who are going to be facing more dire childcare challenges come the fall, and already have been for the last 4 months or so. And every single one of these families is just hacking their own solution to childcare, and it's often piecemeal, expensive, and very stressful. So that just brings us to a really interesting question. Why do we have public schools but not subsidized pre-K childcare? I'm going to give you just a 2-minute history lesson here. We actually did have a government-funded child care system once upon a time. In 1943, they passed the first and so far only national child care program. And it was public care for children whose mothers were employed during World War II. So when women entered the workforce, it just became immediately obvious that there was this need for childcare. And somehow as a country, we've completely lost sight of that need, even though there's a lot more women in the workforce now and the need has only grown. So under the Lanham Act, a mother could send a child of 2 to 5 years of age to childcare for 50 cents a day. It's about $7 today. So with inflation accounted for, it's a monthly cost of about $150, which is quite different from the $1,500 average cost of a daycare today in Portland, Oregon. There are also some companies that offer childcare options. Actually, the Kaiser Center built Shipyard childcare centers here in Portland, Oregon. And those are 24-hour childcare centers. So there's a recognized need that if you have shift workers who are working around the clock, that you need 24-hour childcare options. Unfortunately, this program ended in World War II. There was a survey of women employed during World War II, and 90% said they wanted to keep their jobs. But people, mostly men, felt that women should go back to the home where they belonged and that this just wasn't a need anymore. So we didn't really do anything for about 30 more years. And then in 1971, Congress actually did pass a bill called the Comprehensive Child Development Act. And amazingly, it was a bipartisan vote, which seems unthinkable now. And that would establish a network of nationally funded, locally administered child care centers to provide education, nutrition, and medical services. And it was just an acknowledgement that there were more women entering the workforce and there was this huge gap. Unfortunately, there was some opposition that came mostly from Pat Buchanan and this anti-feminist named Phyllis Schlafly, who had 6 children of her own, and for whatever reason was adamantly opposed to having women in the workforce and offering them childcare. So in the end, President Nixon vetoed the bill. He worried that it might constitute a communist approach to social services and undermine traditional family structures. So it's been almost 50 years since that didn't make it through made it through Congress, but Nixon vetoed it. And there's just hasn't been the political will to pass a national child care bill since then. Even though now about 63% of mothers who work have preschool age children, and that number was 34% back in 1975, around the time when this bill was on the table. Elizabeth Warren is one of the first political candidates that's really talked about this issue on a national scale, but it's largely just been swept under the rug and ignored. So that brings us to our current system. What we've been left with is just a patchwork of private childcare options. They're simply out of reach for many families, and they keep many parents, mostly women, out of the workforce. I know a lot of women who quit their jobs when they had their first child. It wasn't so much that they wanted to leave the workforce, but their paycheck just wouldn't justify the childcare costs. And then even the women who managed to stay in the workforce after their first child, I know many more who left after their second child, especially if you have kids who are both going to be pre-K at the same time. That could be $2,000 to $3,000 a month in childcare costs. And it can be even harder for single parents who often pay 5 times more than what the government would consider affordable for childcare costs. So that brings me to my next question is, okay, childcare costs a lot of money. So where are all these childcare providers who are just raking in the dough and living it up? But unfortunately, the huge amount of money that we spend on childcare doesn't really lead to economic security for our childcare providers. Childcare is it's not a profitable enterprise. Care work in general is not a profitable enterprise. I know we have some business owners on the call, so if you have some free time and for fun, you want to come up with a viable business plan that includes a healthy profit margin for a childcare center, I would love to see it, but it's been very hard. And I would say to the extent that childcare is affordable at all for parents, which it's not particularly, it's only because the childcare workforce effectively subsidizes childcare costs with low worker wages. So here in Oregon, the average childcare provider makes about $2 above minimum wage. People who live in poverty are more likely to experience toxic stress and depression and chronic health issues. And, do we want people who are battling these issues to be taking care of our children and to be responsible for providing enriching and nurturing environments for our children? A child care worker in Oregon who needed her own child care would have to spend over half of her earnings. And qualified childcare providers are just really hard to find. When you talk to childcare center directors, about 68% feel that the quality of their programs are compromised because of staff shortages. So that all leads to this notion of a childcare desert. Because the work itself is undervalued and underpaid, there's just simply not enough providers. So they define a childcare desert as any census tract with more than 50 children under age 5, where there's more than 3 times as many children as there are licensed childcare slots. Pre-COVID, every county in Oregon was considered a childcare desert. I actually don't know if Washington, D.C. is officially considered a childcare desert, but I was living there when I had my daughter. And I knew women who were getting on daycare lists like the day that they found out they were pregnant, and often still having to wait a year before they could get into those daycares. So let's talk a little bit about why childcare is important. I mean, you know, there's the argument that children are our future and that we should care about the quality of their childhood. But I don't know, that argument doesn't seem to gain much traction. So here's another one. In the words of Bill Clinton, there's very much an economic argument for childcare. I love the framing of this, just that care work makes all other work possible. It's the unrecognized backbone of our economy. So I would say that COVID has definitely brought this reality more to light. I'm a little shocked that it took something this dire for people to realize that childcare is an essential service and that it's important to keeping the engine of a healthy economy going. We lose a lot of money because of inadequate childcare access. This is a statistic pre-COVID. I imagine it's actually a lot more now. I wasn't able to find any specific numbers. But meanwhile, when you invest in high quality early child care, there's a huge return to society. I mean, honestly, if I got a 13 to 16% return on any investment I made, I'd be very thrilled. And even though, you know, childcare as a private enterprise is not particularly profitable, but as a public enterprise, it has huge benefits to the economy. It benefits employers who are able to keep a more consistent workforce and have more focused employees. It benefits working families who can better balance careers and family. And it also benefits, you know, our next generation of leaders, workers, and taxpayers, which are namely our children. It's really important to get quality care when you're young. There's a lot of studies done about the importance of preschool, high quality preschool options. So what now? Again, a lot has changed with COVID, and while there has been some more awareness around the need for childcare, as of yet, there's not a lot being done about it. When the CARES Act was passed shortly after COVID really began in earnest, the airlines got about a $25 billion bailout, and I actually was trying to research if they've gotten more since, and it was hard to find, but there's definitely a disturbing discrepancy between which industries have gotten government support. As part of that same legislation, the childcare industry across the entire country got $3.5 billion. And as another point of reference, Harvard University, one college, was offered about $9 million as part of the same legislation. They did not take it, but just thinking about how far $3.5 billion can go across the whole country when one university is offered almost $1 billion. So childcare just continues to be an afterthought. It's estimated that childcare centers need about $9.6 billion per month to make it through the pandemic, and they're clearly not getting that. And there's some dire predictions about how if this pandemic does ever end, about half of daycare centers in the US could be gone. So childcare deserts are bad now. If we were already living in a classified childcare desert, it's going to be even worse. I've already heard many reports of childcare centers closing. My youngest is going into kindergarten, but the preschool he was at, they don't know if they're going to reopen in the fall. So there's just going to be even more of a shortage of viable childcare options. So that leads us to, you know, where can we go? Where can we go from here? And it's just hard to know what the outcome of COVID will be when it comes to our conversations about childcare. I mean, on the one hand, in the beginning, it seemed like there were more fathers who were taking on childcare roles, and maybe those in power, particularly men, might seem to be waking up to the importance of childcare. And there were some predictions that maybe preschool teachers would get paid more after the dust settles because people realize how important their work is. And I know the organization that I've been volunteering with, Family Forward, does hope the pandemic will shine a light on just the need for a stronger childcare infrastructure in our country, because countries who already have that infrastructure in place, they're just facing far fewer challenges when it comes to reopening the economy. But on the other hand, as I was talking about, childcare options might become even harder to find. I have heard reports of women quitting their jobs in record numbers because they simply can't work and take care of children at the same time, and there aren't any viable options right now. I think it could really reverse some of the progress that women have made getting into the workforce. So there could be some positive outcomes, but it's just hard to tell right now. And I've spent a lot of time so far just focused on all the problems with our childcare infrastructure. So I would like to talk about some solutions. There was a summit put on by Family Forward last year. It was pre-COVID, but it was about envisioning a childcare system that could work for everyone. And I will get to this a little later on, but I do want to be clear that I don't think businesses are responsible for solving our childcare crisis. I strongly believe that the best solution lies in a government-funded solution that's accessible to everybody. But I do think businesses can play a role, and I'll get into that a little bit more later on. But we identified just some of the criteria that would that you would really need to take into account when creating an inclusive childcare system. So one is that childcare centers need to be open. And they need to be open not just during working out, what's considered normal working hours, but early mornings, evenings, and weekends. So I work what many would consider normal hours, 8:30 to 5. And I have to say, this has still been a huge barrier for me. I just can't count the number of times I've found a childcare option and gotten so excited about this full day option, and then find out that their definition of full day is 9 a.m. to 3 p.m. And that's just not going to work for me. It's been so hard to find options, particularly pre-K options that are actually open the amount of time that I need to get the kids there and then to get to my job and put in a full day. So if it's that hard for me, what about shift workers who work evenings, nights, and weekends? A doctor might be able to afford a nanny, but there are many people who do shift work who don't have that option. So another criteria is close to work or home. So again, when I've been dealing with my spreadsheets and looking at all the options, again, I'd be super excited to find an option and then realize it's out in Selwood or St. John's. I live in Montevilla. Before COVID, I was working downtown. I've been working from home now, but when you're dropping your child off and picking them up every single day, it needs to be somewhere accessible. You can't go an hour out of your way to drop your kid off and still put in a full day of work. And we've talked about affordability a lot. So the general recommendation is that a family really shouldn't be spending more than 7% of their income on childcare. In many instances, I've spent between 20 and 35% of my income on childcare, by contrast. Then high quality is also a given. We have to take into account these other factors logistically, but we still want childcare that promotes a child's social, emotional, physical, cognitive development. And also appropriate. So we need childcare options in a child's language. We need culturally competent providers. In some cases, the best option for a family might be a family member, and I 100% believe that family member should get compensated for that time. As I was saying, for me to put in an 8-hour workday, my children are usually in care for 10 hours a day because I need to get them somewhere and get to work. So that means the childcare provider is working more than full time. And as anyone who's watched children knows, it's just incredibly demanding work. And whether it's a family member or a neighbor, anyone who is doing that work should get compensated for it. And also, clearly a system that values providers. So a system where we don't have childcare providers who are experiencing the toxic stress of poverty, but rather they're paid good wages, they get benefits, they get training and the other support that they need. I would say in all of those 14 different childcare experiences that I've had, even the best ones only match a few of these criteria. So I also want to I do want to have some time for questions, but I wanted to leave you with some ideas for what you can do. This is on an individual level. So we do have something here in Portland called a mother pack. It's a pack that's run by Family Forward. They have they have like a lobbying arm and a nonprofit and a pack. I get them a little mixed up sometimes, but basically the purpose of the Mother Pack is to support candidates that will prioritize childcare among many other progressive issues. I'm on the endorsement committee, and we're in the process now of starting to talk to candidates who will be on the ballot in the November election and seeing which ones will get our endorsement. So you can keep an eye out for who's being endorsed by the Mother Pack. And also, in an encouraging development, there are 2 measures that might end up on the November ballot. Each of them, there's universal preschool or preschool for all, and they each have the goal of providing a government-funded preschool option for Multnomah County. It's still not a comprehensive solution. It doesn't really meet all those criteria that we saw on the slide before, and it doesn't account for the gap between birth and 3 years old, where people are still going to have to find childcare. But I would say it's definitely a solid incremental improvement in the right direction. And I'm honestly not super clear on the differences between them, and if one or both will end up on the ballot or none at all. But if one of these is there, it's definitely something that's worth voting for. I would also say just educating coworkers and friends. I've been pretty outspoken at my current job about these issues, and so shocked by just how, particularly my childless coworkers, through no fault of their own, just have no idea that this is even an issue. It's just not something that's being talked about very much in other platforms. And if it's not something you're personally dealing with, I think I may have inadvertently scared at least one coworker away from ever having children, which was not my goal, but it was just like so much shock that the system is as bad as it is right now and presents so many challenges for working families. So honestly, if you want to take this presentation and adapt it to you and give it at your workplace or to any other group that you think would be interested in hearing it, I am all for that. I'm happy to share it. And then, you can always support with your dollars. Family Forward, again, I just can't say enough good things about it. They don't pay me to endorse them or anything like that. But they've actually been working very closely with Kate Brown on childcare during COVID-19 and beyond. There's a virtual town hall they helped organize with Governor Brown that had over 400 participants that were talking about these issues. I've worked for 3 nonprofits that, knowing their inner workings, I don't donate to them, but I do donate to Family Forward monthly, and I just know that the donation is incredibly impactful, and they're really dedicated to this cause. So then, what can your business do? And again, I don't think that businesses are responsible for solving this problem. I have a boss who's so receptive to hearing about these issues and challenges and keeps asking, what PixelSpoke could be doing to help better support me. And there are some things, but really, this is an issue that requires a more comprehensive solution. I will say a few things that we've done at PixelSpoke that have been helpful is since the start of COVID-19, we've started this working parent employer resource group. We just hop on Zoom for about a half hour a week and just check in with each other and talk about the challenges we're having. It's been hugely helpful. I look forward to that call all week. It just makes me feel a little bit less alone. So that's one thing. And, some of you might be familiar with FFRCA benefits. One positive element of the CARES Act was that there was a recognition that people might have to reduce hours or drop out of the workforce to take care of children. In my case, I work for a small company, and there's no one else to do my job, so it's very challenging, but I have reduced my hours to 32 a week. I had this little honeymoon period. My husband was furloughed for about 6 weeks, which presented other challenges, but at least he could watch the kids. And he went back, he works outside the home at a healthcare clinic and went back in May. And since then, it's just been incredibly challenging. But I am accessing the benefits. Small companies can apply for exemptions, but I would encourage you to consider offering this to employees who need it. Perhaps with some increased PTO. The FFRCA pays like 60-something% of the wages I'd normally earn, 2/3, I think. So to keep my same pay level, I have to use a few hours of PTO every week. And actually, I have not talked to my company about increasing PTO, but I know if I keep this up through the fall, it's going to eat into my PTO quite a bit. And again, your business can also make donations to organizations who are doing work on this issue. At PixelSpoke, we donate 5% of our profits to local organizations, and Family Forward is one that's on the table for this quarter. Lastly, what can the B Corp community do? I know many of you on this call are work at B Corps or are trying to get certification. This applies to non-B Corps too, if you're not working at a B Corp, but I do think there's an opportunity to just band together to raise awareness around the issue. So it's not a problem I'm expecting B Corps to solve, but you know, maybe there could be some kind of task force that just gives voice to the issue within the business community. Writing op-eds is an old-fashioned, tried and true method that raises awareness. And just really emphasizing how critical childcare is to a healthy economy, just making that business case for it. I've seen the B Corp community here really amplify support for different ballot measures that kind of fit into their vision for an inclusive economy. So whatever preschool initiative ends up on the ballot, I hope one of them does, just to amplify support for that through social media and other channels. So we have about 11 minutes left. I'd love to address any questions, and I'd also love to hear your thoughts. If you have other thoughts for what the B Corp community or what your workplace can do, I would love to hear them, because I be honest that I got a little stuck on that, and I would really love to take some broader action within the B Corp community around this issue, so I'm certainly open to other suggestions. And I think probably best to just use the chat feature if there are questions.
And it looks like there's one question in the chat about explaining the FFRCA benefit.
So I wish I had our operations manager on the call. As far as I understand it, this is a benefit that businesses can use to essentially keep the rate of pay the same for someone who needs to reduce their hours. I believe they could use it to, if they just needed to take a few months off from work, it would be similar. And the business gets, I believe, paid back for the wages. It has to do with filing taxes. So the business is not on the hook for paying out the benefit, but they might have to in the short term and get compensated for it. And it applies to, there's different, my husband's using something different because he also works at a company under 25 people, and they actually did apply for an exemption, but he's able to tap into some sick leave benefits provided through CARES, the CARES Act, which you can also apply toward childcare. So it's a little confusing, and I don't completely understand it, but it is an option. I'm currently the only person at my company who's using it, and it's not solving my problem. Working with children around is just very difficult, no matter which way you cut it, but doing it for 32 hours a week is a little less difficult than 40. So I would just, and I would be happy to connect people to my operations manager if they wanted to know how to get started on that. Oh, great. Oh, yeah. I'm glad some other people are using this benefit. There is actually a survey that went out, and tons of people were not even aware that this was an option. So even though the government did pass this, a lot of working parents who could be using it aren't tapping into it because they don't know about it. Yeah, and as far as I understand right now, it's good through the end of December. Who knows what to expect from our government, but given that I don't think a lot will be solved by December, I'm hoping it will extend into 2021 as well. Yeah, that's a great question, Allison. Allison's asking if any businesses been exploring implementing childcare programs during this time. I would love to hear from you guys if you've heard of that. We have talked about potentially offering a childcare subsidy. But the irony is that it's right now, it's not so much the cost that's the issue. It's just childcare. Just, you know, having a childcare option that we would feel comfortable with or can even find. So we
yeah,
did.
I know that at our office, our owner, you know, looks at the office space that's just sitting empty, and is like, you know, and then seeing how parents, we have two of my colleagues have school-age children, and then myself and two other of my colleagues have toddler-age kids. But it's like saying, how can we utilize that office space to bring those families together? You know, it does create some risks of being exposed to other families, but if my kid's in daycare, you know, with a bunch of strange families versus my colleagues, you know, so we're kind of exploring or talking about that, or even having just the school age kids, have that be a place for them to come and be during the school day if schools don't reopen.
That's really,
so, yeah, kind of just using our space
mm-hmm.
since it's not being used.
Yeah, that thought crossed my mind as well. And I guess in that scenario, I'd probably end up working there because my only thing was like, well, that's all the way downtown. But if I were also working there during the day, that's an interesting thought. Yeah, I mean, I do think, while I don't think businesses are responsible for solving this broader crisis, I do think they could think creatively about what to do right now when it's even more of a crisis than usual.
I think one of the things to think about that my colleagues kind of point the other day was, it is way less expensive in the short or in the long run for an employer to help fund any of these solutions right now than to lose an employee. Mm-hmm. Or to have an employee be like, have to go down to half-time, or, you know, just finding ourselves in that challenge. So it's like, how can we help our working parents be able to do their job and fund in whatever creative ways childcare as a temporary solution to get us through this time? Because again, like in the long term, it's like a short-term cost for longevity of the employee.
Yeah, that's a great point. And I do think there's something to be said for just kind of a mindset shift. I feel like there's this mindset in our country that we're the ones with the kids, it's our problem. We decided to have the kids, it's all our problem. Whereas if you shift that to a collective mindset of, okay, there is an element of public good in raising children, we're raising the next generation, and that everyone can pitch in to help support us because it furthers the common good. And I'm actually reading this comment from Colin about employees being able to donate PT hours to other coworkers who are experiencing different needs. And that's the same spirit. It's like, how can we all pitch in to help these people who are in a tight spot right now, but we don't want to lose them, and them having more time and focus for work will make us all stronger. Any other questions or creative thoughts about either stopgap measures or more permanent solutions?
I do have one quote too. The quote in the very beginning was just so powerful that, you know, how can childcare match work hours, right? And that can also be flipped, that can work hours match childcare hours. So it's like, do we meet in the middle? Do we lengthen the hours that children are outside of the home, or do we shorten the amount of hours that the parent is outside of the home or the caretaker?
That is a great point. I've been a very vocal proponent of a 4-day work week at my company. So far, the economic case for it is difficult. I think when you build a company business model around a 5-day week, shifting to a 4-day week can be very difficult. But I think if you start a company from scratch, that's a little easier. But I 100% agree. I mean, just like the school system was built around the needs of farmers, the 40-hour work week has its own history, and we've kind of, it's kind of become the holy grail of what full-time means. And honestly, I mean, who are we kidding? It's really considered the bare minimum these days to work 40 hours a week. And just thinking about how much time you have to spend away from your children and how much time they have to be in care for you to work those 40 hours, it's a long time. I mean, I felt, my daughter is a social butterfly and loves being away from the house and loves being independent. But for my son, you know, he was spending about 50 hours a week at his preschool, and he really didn't like it. He was the first one to get dropped off, the last one to get picked up. And this is me again, working normal hours. And I think there are great benefits to children being in childcare, but it just seemed like too much. And I just don't think 40 hours promotes a healthy work-life balance, particularly for parents. So if any of you on the call are in the beginning stages of starting your company, that's definitely some food for thought.
Well, thank you so much. We've reached time.
Yeah. Well, again, I really appreciate you coming, and there will be access to a recording. And if you want a version of this presentation to adapt, please reach out to me. I would be more than happy to have this be shared more broadly.
Awesome. Well, thank you. And thank you everyone for joining. We usually put links in the chat, but I think since we have some folks leaving, I'll just put it in there. And then when you get the recording, you can take a look and see.
Great.